Okay, so today we are going to give you a oral mech exam. So I'm just going to look at the muscles in your face and your mouth to see if they're working properly. I'm going to have you do a few simple movements so you could just follow my instructions. Alright, so I'm first just going to have you rest your face and look straight ahead. I'm looking for any facial symmetry, any drooping. Everything looks great. So that involves our facial nerve, which controls our facial expressions. Alright, now I'm going to have you give me a big smile. Okay. And now I'm going to have you puff some air into your cheeks like this. And don't let me push out any air. Okay, great. That is, again, our facial nerve. That is responsible for our voluntary movements of the face. Now I'm going to take a look at your jaw and your jaw strength. So first I'm going to have you open your mouth wide. Now close it. One more time. And now I'm going to have you move your jaw side to side. Great job. And now I'm going to apply some pressure, so move it to the left and don't let me push it to the right. Now same thing for the other side. Okay, great job. And that is our trigeminal cranial nerve, and that controls the muscles of mastication or chewing. And I'm just going to have you clench your jaw, and I'm going to feel the TMJ. Okay, feels great. All right, for this one, I'm going to have you close your eyes, and when I touch parts of your face, raise your hand when you feel the sensation, okay?
Mm-hmm.
Okay. All right, great job. And I'm going to do the same thing, but this time I'm going to have you close your eyes and stick your tongue out, and I want you to tell me what you taste.
Mint.
Okay, great job. So that is also our trigeminal nerve, and that's our sensation to our oral cavity and our face. So you're doing a great job. We're going to move on to our lip movements. So I'm going to have you pucker your lips or like you're whistling. Great job. I'm going to apply some pressure for when you push your lips out like that one more time. Okay, feels great. And that is part of our facial nerve. It innervates the muscles of the lip and their movements. And now we're going to move on to our tongue movement. So I'm going to have you stick your tongue straight out. Okay, and now move it to the left and right, up and down. Okay, looks great. I'm going to apply some pressure when you do that. So go ahead and stick it out to the left, okay, to the right, up, down. Great job. So for that one, when I push your tongue, I'm just testing the strength, and that involves our hypoglossal nerve. It controls the muscles of our tongue. So I was just looking for any deviations or anything like that for that. And now I'm going to have you open your mouth, and I'm going to look at your soft palate and uvula. So I'm going to have you say, ah, ah. Okay, great. That was great. Elevation and uvula position, and that involves our glossopharyngeal cranial nerve, which is our sensory input, and the vagus one, which is our motor. So now I'm going to do a gag reflex. I'm not actually going to do it. The gag reflex, I would gently touch the back of your throat, and that would be our glossopharyngeal and vagus nerve, but we're going to skip that one today. We're going to move on to saying a few sounds. I want you to say E and hold it for as long as you can. E. Great job. I was looking for any nasality or breathiness, but your vocal quality seems great. And that involves our vagus nerve. It innervates our larynx and our pharynx for phonation. All right. Now I just want you to swallow. I'm going to feel your swallow. Perfect. That's felt great. That is our vagus nerve. It controls our swallowing reflexes. So now I'm going to have you lift your shoulders like this, and I'm going to apply some pressure, so don't let me push it down. Great. And now I'm going to have you turn your head to the left. I'm going to apply some pressure, and now to the right. Great job. That is our accessory nerve, and that controls some of our muscles here and in the neck and the spinal cord. So now I'm going to have you do some rapid speech sounds. So you can repeat after me. For the first one, we're going to do po 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 po, and you're going to do that for 10 seconds, as fast and as clear as you can. Ready? Go. Great. Awesome. So that is testing our facial nerve for our lips and our trigeminal nerve for our jaw stability. Our next sound is going to be T. So this is going to test our tongue tip elevation, which uses our hypoglossal cranial nerve for that tongue movement. And we'll just switch it to 5 seconds, so go ahead. Great. All right, and now we're going to do k. And this one is for our posterior tongue elevation, and it's using our vagus nerve. So go ahead. Great job. And now for the last, we're just going to put those together, and for 5 seconds, say it as clear and loud as you can. Putka. Great job. All right, awesome. You finished, and everything looks great today. Yeah.
Thank you.